as we have already discussed, hepatitis A. Now we are going to discuss hepatitis B. What is hepatitis B? Hepatitis B is a serious liver infection caused by the hepatitis B virus, HBV. For some people, hepatitis B infection becomes chronic, meaning it lasts more than 6 months. Having chronic hepatitis B increases your risk of developing liver failure, liver cancer or cirrhosis, a condition that permanently scars of the liver. Most adults with hepatitis B recover fully, even if their signs and symptoms are severe. Infants and children are more likely to develop a chronic, long-lasting hepatitis B infection. A vaccine can prevent hepatitis B, but there's no cure if you have the condition. If you're infected, taking certain precautions can help prevent spreading the virus to others. How hepatitis B virus transmit, or spread. You can become infected with hepatitis B through exposure to blood, semen and other bodily fluids of an infected person. You can get the infection by having unprotected sex, sharing or using dirty needles for drug use, tattoos or piercing, sharing everyday items that may contain body fluids, including razors, toothbrushes, jewelry for piercings and nail clippers. Being treated medically by someone who does not use sterile instruments. Being bitten by someone with the infection. Being born to a pregnant woman with the infection. What are the symptoms and signs of hepatitis B virus? Signs and symptoms of hepatitis B range from mild to severe. They usually appear about 1 to 4 months after you've been infected, although you could see them as early as 2 weeks post-infection. Some people, usually young children, may not have any symptoms. You can face these signs and symptoms. Abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea and vomiting, weakness and fatigue, yellowing of your skin and the whites of your eyes, jaundice. What are the most effective prevention from hepatitis B virus? First, hepatitis B is preventable and treatable. Eat a healthy diet full of fruits and vegetables, exercise regularly, and get enough sleep. Take care of your liver. Don't drink alcohol or take prescription or over-the-counter drugs without consulting your doctor. Get tested for hepatitis A and C. The best way to prevent HBV infection is by getting vaccinated. Hepatitis B is transmitted when blood, semen, or another body fluid from a person infected with HBV enters the body of someone who is not infected. How is hepatitis B treated, and is there a cure for chronic hepatitis B? Your healthcare provider will treat you, based on what type of hepatitis B you have, acute or chronic. Let's discuss what is acute and chronic. Acute hepatitis B infections. If you develop an acute, short-lived form of the condition, you probably won't need medical treatment. Instead, your doctor will likely suggest that you get plenty of rest, drink lots of fluids and maintain a healthy diet to support your body as it fights off the infection. Chronic hepatitis B infections. If you have chronic hepatitis B, you might be a candidate for drug therapy. Usually, drug therapy is used only if you have active liver disease. There are 7 drugs that are approved by the U.S. Food and Drug Administration to treat hepatitis B. 2 are injectable forms of interferon, while the 5 other antivirals are tablets. Currently, there is no complete cure for hepatitis B. But when managed properly, those living with the virus can expect to live a normal life. Maintaining a healthy diet and avoiding alcoholic beverages and tobacco products are crucial components in managing the disease. You should also visit a doctor familiar with hepatitis B at least annually, though twice a year might be best, to monitor your liver through blood tests and medical imaging. As with most diseases, detecting it early leads to a better outcome. If you're exposed to the virus, you should get an antibody injection within 12 hours of exposure. Thank you for watching the video.